Dear students, welcome to the second course in your Basic of Clinical Medicine. This e-learning course is the final one. If you pass this course, you will get a credit. In this course will be a couple of questions, and also because unfortunately you have missed, let's say, ward round in our hospital. You haven't seen our hospital due to this severe situation. So I try to show you some pictures from our hospital just to introduce briefly our standard ward, our intensive care unit, operation theater, and so on. I think the questions are very easy. Some of them maybe will be a little bit tricky for you, but the point is for you to think about it and maybe to discuss about it, and I'm sure you will pass without any problems. So let's start. We discussed the basic terms like diagnosis, symptoms, syndromes, and so on, so on. So first question, what does it mean, diagnosis? Try to choose the best option, please. And the second question at the beginning, what does it mean, symptom? Again, try to choose the best option. The only one option is correct. And now we will go throughout our hospital very briefly, very shortly. This is our place where we admit patients, our acute admission to the hospital, and maybe you know basic classification like high severity threshold admission and low severity threshold admission. If the patient is not in severe condition and and come with some acute problem to the hospital, but can, let's say, wait a couple of minutes, sometimes maybe 1 hour, he can spend in waiting room this time. So this is low severity threshold admission, and then this patient continue to normal acute ambulance. And it depends, if he has some surgical problems, he goes to surgical ambulance. If it's neurological, internal disorders, he is sent to this special ambulance. This is how the normal acute ambulance looks like. As I said, it's low severity threshold ambulance, and this is place where is a doctor with nurse, and the doctor is doing basic clinical examination. He's doing basic lab test, and he indicate some imaging methods. My question is, clinical examinations doesn't include, be careful, doesn't include, try to choose the best answer. And the second question, physical examination include. And now we go to high severity threshold ambulance or high severity threshold department. What does it mean? It means when the patient is really in severe condition. He is usually transported to the hospital with paramedics, or he can be transferred also with helicopter. He must go immediately to what we call emergency room, or you can find also a term like shock room or crash room. This is how emergency room looks like. It's place where is everything what we need in acute situation. The boss in this department, in this ambulance, is anesthesiologist, because crucial is to monitor and to check the vital functions. So the monitoring and assurance of basic vital functions is crucial in the emergency. And just for you to imagine which kind of patients are transferred to this emergency room, it can be polytrauma or severe injury, severe burns, intoxications. It can be severe stroke or myocardial infarction. It's all these situations means that the patient is really in life-threatening situation, and without urgent intensive care he can die. So question is, what does it mean, basic vital functions? From this emergency room, the patient can be transferred to intensive care unit, or, for example, if it's required any surgery, he's transferred to operation theater. This is picture from our intensive care unit. What is crucial? There must be equipment for monitoring, again, of the vital functions, and of course staff equipment. There must be a lot of nurses, a lot of intensive unit specialists, nurses and doctors. This is the bed in intensive care unit, and I try to show you the crucial things, what is important in the intensive care unit. Monitor with a lot of probes, which is for monitoring blood pressure, heart rate, ECG, central venous pressure, and so on, so on. And of course, infusion pumps for administrating infusions, in these machines for administrating intravenously a lot of drugs, painkillers, antibiotics, and so on, so on. And on the other hand, this is our standard room, in standard ward. You can see usually we have 2 bedrooms with a bathroom for these 2 patients. Important is comfort for the patient, privacy, and of course in this room must stay only patients who doesn't require intensive care. Patients staying in the hospitals have a lot of catheters, which are important for monitoring, for administration of drugs, and for other reasons. And you have seen maybe in hospitals that the patient has a lot of plastic tubes. It can be peripheral venous catheter, central venous catheter, urinary catheter, nasogastric tube, tracheal tube, and so on, so on. I know maybe it can be difficult for you now, but I show you some pictures and you will try to recognize which catheters are on these pictures. So please try to find correct answer. So I think you had no problem to recognize peripheral venous catheter. I'm sure majority of you had sometimes blood test and you had a peripheral venous catheter. It's very common, or maybe the most common catheter we use in all patients in hospital. The other catheter is central venous catheter. If we need to infuse a large amount of infusions, blood units, or we can also measure central venous pressure, we use central venous catheter. I will show you pictures and videos how we insert central venous catheter. So first step is, like everywhere, disinfection of operation field. We can call it operation field. So we must use disinfection, and of course it's a crucial and important role of not only asepsis but also antisepsis. And we prepared place. In this situation we will try to punction subclavian vein and insert central venous catheter to subclavian vein. The second step is local anesthesia. We have a lot of options how to do it. This is the most common option how to do it. We infiltrate the place with special liquid, and the role is to be more comfortable for the patient. In the video you can see how we infiltrate subcutaneous tissue and also deep layer with the mesocyme liquid, and later it will be not painful for the patient. The second step or third step is to insert a special needle, and we try to aspirate and we try to reach subclavian vein. You recognize it when you reach subclavian vein immediately, because you can see we sucked the dark blood. So now we know we are in subclavian vein. We insert a special wire. This will help us later to insert the catheter. When we insert the wire, we can remove the needle. You will see it later. Now we remove the needle, but we have the wire inside of the subclavian vein. And via this wire, we make first small dilatation with the special dilatator to make a bigger hole, not only to the skin, but also to the vein. And then finally, we insert the central venous catheter. If you remember from anatomy, the central venous system, try to imagine or look to the anatomical atlas. And this catheter has a 3 lumen. It's very helpful. And final step is to suture the catheter to the skin to avoid the dislocation, and that's it. Unfortunately, what you couldn't see this year is also operating theater in our hospital. And I'm sure you will see it later in 3rd or 4th and 5th and 6th year. But in next slide, I will show you very shortly a video from our theater, just to see how big is this theater. It's pretty modern, big, new theaters, which are very nice. And later you will see also the operation in this theater. In this picture, it's a very difficult question for you maybe. Try to find which picture is without any mistake. This is process of washing myself before the surgery. So we use a scrub, and this is preparing before the surgery. And in 3 pictures, I made some mistake. Try to find which picture is without mistakes. It's a little bit tricky. It will be interesting if you recognize it. And I have another question from the field of operation theater. You know, we must change our clothes before we enter the theater. We must use operation clothes. It can be single-use paper clothes or textile one. And question is, it's a principle of asepsis or antisepsis. And this is finally picture from the theater where it's just running some operations and surgery. And you can see operation group. We have a main surgeon here, the first assistant across to him, the second assistant next to him, the nurse, she's passing the instruments, the suture material and whatever, and of course anesthesiological group, the doctor and again the nurse. Later I will show you also video from this surgery. I have one question, and again I know we didn't mention this issue in our lectures, but the point is, maybe try to think about it. Maybe you will find it in Google. Maybe you can discuss with your friend, but I will be very happy if you will be thinking about the correct answer. In the theater we have some electrical outlets. We have different colors of these outlets. Do you have any idea why it is? And another question from the field of theater. You can see in this picture the operating table is in the middle of a red square or whatever it is. Do you think it's any reason to place the table just in this position? Try to think about it. I'm sure you have answered correctly. It's again and again question of asepsis and antisepsis. This is question of asepsis. It's due to air conditioning. The point of air conditioning in operating room is to avoid contamination of operating field. So in this picture you can understand how does the air conditioning is working in operating room. Okay, and in the last slide you will see the short video from the surgery. You can see everybody knows what's going on, what it's his role. They are not talking so much because everybody knows what he must do. So look at this video and think if you don't want to do surgery in your future. So thank you very much that you have passed this short learning course. I'm sure you were successful, and I hope we see each other in the future. I hope this subject helped you a little bit in orientation in crucial terminology, in crucial informations from clinical medicine, and it will be helpful in your future. So see you next time. Bye bye.